There are a few interesting features of the small intestine channel. It is meant to relate to digestion, and the pathway supports the stomach and connects or belongs to the small intestine. It is also a channel that is in Biao-Li external-internal relationship with the heart, and as Tai-Yang hand, it relates to the bladder channel, which does enter the brain. These two features are interesting because we tend to not think of the small intestine channel points as digestive points or as related to mental conditions. This is perhaps because we have a tendency to look at channels as having their most important features on the arm or the leg. But the small intestine channel does emphasize the shoulder. It says that it follows the back of the bicep, enters the shoulder divide, rotates around the shoulder blade, entering the shoulder top, and then moves on to stomach 12. And the concentration of points is in the shoulder, with names that emphasize the shoulder as well as Tian, heaven. This suggests to me that we may want to look at the small intestine channel as the shoulder channel, and that may offer us different insights and ways to access the idea of it being digestive in nature as well as mental or brain in nature. This will offer us ways to relate our modern concepts of the release of serotonin in the enterochromaffin cells, which are in the epithelial lining of the small intestine, to the Chinese idea of relating the small intestine and the heart. Indeed, our gut movement is related to our happiness. The small intestine function is to separate the pure and the turbid, and the pure would include hormonal secretions. Taking into account the small intestine's connection to the brain via the heart and the bladder, this suggests that the small intestine channel is related to the brainstem as a serotonin pathway, and especially to the hypothalamus and the pituitary as the hormonal control towers. One way to look at small intestine 1, small intestine 2, and small intestine 3 is similar to the way one might look at large intestine 1, 2, and 3, as related to the three parts of the organ, the three parts of the small intestine: the duodenum, the jejunum, and the ileum. Small intestine 1, 小子, the small marsh, would represent the duodenum, which is basically a pond or a marsh, which receives the chyme, the bile, and the pancreatic enzymes. Small intestine 2, Yongku, before the valley, could represent the jejunum, which is where the food, the gu, is being absorbed. And finally, small intestine 3, Huoxi, after or behind the creek, would be the ileum. The character xi for creek or ravine has the character for gu on the right-hand side, with a phonetic xi to the left of it. So in a sense, small intestine 2 and 3 both have gu, valley, or grain in them. One is before the valley, and one is after the creek or after the valley. With this interpretation, we can use these points for the first function of the small intestine channel, digestive issues. These might reflect as pressure pain on Ren 9, shuifeng, dividing water, which is resonant with the small intestine's function of dividing the pure and the turbid. Or it might reflect as pressure pain or bloating feeling when the full, flat palm is pressed over the navel. Generally, I prefer small intestine 1 and 2 for this, as I tend to give preference to metal-water point combinations. However, there are times when small intestine 3 proves to be the better choice. We also saw that the small intestine channel is resonant with the brain, and especially with the pituitary and hormonal control. Small intestine 2 and 3, before the valley and after the creek, are resonant with Du 21 and Du 19, Qianding and Huoding, before and after the vertex, which surround Du 20. We might ask how small intestine 3 was chosen as the opening point for the do, and there will be many ways to find connections between the do and small intestine 3. But we can see that very early on there was some correspondence between the upper do, the brain, and the area of small intestine 3. Small intestine 1, 小子, the short marsh, may be a representation of the duodenum, which is shorter than the jejunum or the ileum. Small intestine 2, Yongku, in front of the valley, connotes the jejunum. It is also related by name to do 21, Tianding, in front of the vertex. I believe this is one of the points where the character gu is actually meant to suggest grain and not merely used as valley. In practice, I tend to use small intestine 1 with small intestine 2 as a metal-water combination when there are digestive issues that may show up as pressure pain on Ren 9 or as full palm pressure over the navel. For small intestine channel pain, Heart 3 often does a better job than the combination of small intestine 1 and 2. Small intestine 3, 或息, behind the creek, may be suggestive of the ileum, which is the posterior intestine. Like small intestine 2, it relates by name to do 19, 或定, behind the peak or behind the vertex. So there is a connection between this area and the brain. Small intestine 3 can also be used for digestive issues, and those will show as pressure pain on Ren 9 or as full palm pressure on the navel. But usually, small intestine 1 and 2 will tend to do a better job for that. Small intestine 3 is considered the opening point of the do. I think it is more of an opening point of the pituitary or hypothalamus, and I use it for hormonal issues, especially in women who have been or are on birth control. Birth control pills send false signals to the brain and affect the pituitary. Women who are susceptible to this will often say that they had discomfort with a pill and therefore stopped taking it. It suggests that they have a pituitary weakness. This may show as pressure pain on bladder 2 or around gallbladder 20. Bladder 66 is another main hormonal estrogen point, which is located on the foot in the equivalent mirror location to small intestine 3. Small intestine 4, Yongku, the wrist bone, seems to have a very clear and obvious name referring to its location. However, wrist means the flesh that bends, so it may suggest bones that bend. We do not think of bones as bending, and one place where we might say we have something that appears like the bones of bending or curving is the spine, where the bones might not really curve, but the spine is curving. For many practitioners, small intestine 4 is a better point for spinal problems rather than small intestine 3. And this is not surprising, given the name. It is my experience that small intestine 3 tends to reach the neck and the occiput and sometimes the shoulder area, while small intestine 4 tends to reach the lower back as well. Small intestine 5, Yongku, the Yang Valley, is seen by some people to be related to gu as in grain, and related therefore to kidney 10, Yin-gu. The idea is that these points represent the dissemination of the gu-qi to the yin and the yang aspects. For me, the gu here is more related to a valley as a description of the location between the two bones, and the yang is shared in all the names of the wrist points on the yang channels as a way to suggest that the wrist is how we manipulate and interact with the world with yang. As the fire point, small intestine 5 can be used diagnostically for small intestine channel problems. If there is pressure pain here, small intestine 1 and small intestine 2, metal water points, are indicated. However, it is often the case that heart 3 will do a better job for the channel, while small intestine 1 and 2 will do a better job if there are digestive issues. I also use small intestine 5 together with heart 7 for shoulder pain, as one of Kawai's wrist pairs for shoulders. Small intestine 6, Yang Lao, to nourish the elderly, is a point that has a relaxing, untightening effect, especially in the upper body. I believe it is because of its location between the two bones that slide over each other. It suggests movement, flexibility. The character Lao is a person whose hair is changing, presumably towards white, hence an elder. The bottom part of the character is Hua, and that means to transform, to change. It is more commonly written with a person on the left as Hua. Small intestine 6 is a good point for stiff shoulders and can resolve small intestine 11 pressure pain. At times, it can be a supporting point for liver 8, which nourishes tendons, providing more movement to the tendons. Small intestine 7, Jijeng, the upright branch, is a point that I do not use clinically. There are 2 points with a character branch, Zhi, Sanjiao 6, Zhigu, the branching ditch, and small intestine 7. Ellis takes the character Zhi, branch, in small intestine 7 to refer to it being the low point, and the upright part as referring to the heart, which is where the connecting channel goes to. Since the only other point with a character Zhi to branch is Sanjiao 6, Zhigu, for me, the question of why there are only branches on the lower arm and nowhere else in point names still remains unanswered. It is also a question whether this Zheng is related to gallbladder 17, the only other point that contains this character, Zheng Ying, the upright nourishment. While the character is the same in both point names, Zheng Ying also, as a combination, means frightened, and gallbladder 17 is over the fear center of the brain, while small intestine 7 has the textbook indications of mania, fear, and anxiety. It seems to suggest that somehow small intestine 7, with that character Zheng also, provides a branch to the brain, especially or specifically to its anxiety and fear centers. Small intestine 8, Xiaohai, the small ocean, seems to be related by name to heart 3, Xiaohai, the lesser or the tiny ocean. Clinically, I use small intestine 8 as part of the 5-point combination that treats mineral imbalance. Kidney 6, Jiaohai, spleen 10, Xuehai, Ren 6, Qihai, heart 3, Xiaohai, and small intestine 8, Xiaohai. It is easy to press heart 3 and small intestine 8 together and check its effect on the body as a way to confirm the effectiveness of this combination for the patient. Small intestine 9, Jianjian, the shoulder virtue, and small intestine 10, Naoshu, the bicep transport, are named after the location at the shoulder. They exemplify the small intestine as the so-called shoulder channel, and clinically, they demonstrate the connection of the channel to mental and brain issues, specifically to the nervous system. Rather than using small intestine 9 or small intestine 10, I use a point in between and needle it up and out towards the deltoid. But the whole line between small intestine 9 and 10 has these abilities. It is used for any sort of shoulder joint or deltoid pain. It releases the inner border of the scapula, that is bladder 42 to 45 area, the rhomboids, and the upper thoracics. Because it releases the rhomboids, it affects the lungs and is a major treatment point for lungs. Because it releases T2 to T5, it releases the nervous system and acts to relax the thoracic sympathetic ganglia. Whether it does that via the axillary nerve affecting the brachial plexus and hence our breathing, or whether it does it by affecting the teres or the infraspinatus muscles, and by chain reaction the rhomboids which attach to the thoracics, it clearly has a strong calming effect on the sympathetic nervous system, on the thoracic ganglia. This effect is so pronounced that when I needle it, it seems as if I'm on a sympathetic ganglia, even though there isn't one there. It is an essential area, small intestine 9 and 10, to release for blood pressure disorders, both high and low blood pressure. Small intestine 11, Tianzong, heavenly ancestor, is another very important point. If the ancestors are looking down at us, transmitting themselves to us, it would make sense that the connection would be at the depression at the back of the heart. While to some people, the center of the chest, in the front, might make just as much sense, in the line of lineage, we come after the ancestors. So therefore, they would be standing behind us and transmit to our back, rather than standing in front of us and transmitting to our front. Small intestine 11 reflects and treats Zangqi, pectoral qi, especially on the left. Many Japanese practitioners use it to treat lung disorders. In my own usage, I have not quite found this to be the best point for lung problems, but it is definitely an excellent point for strengthening the circulation. It is also a reflection and treatment point for cardiac conditions. I use it as a reflex for cardiac treatments to confirm the use of other points, and then I needle it and apply direct moxa once all the other needles have been applied. On the right side, small intestine 11 reflects and treats the gallbladder, liver, stomach, and is used to treat digestive disorders, including the small intestine itself. Small intestine 11 is also considered the breast shoe and is used for any kind of breast problem. I use it especially for breast cysts at the end of the treatment, having the patient sit up, palpating with their own hand any lumps in the breast, so I can find the right spot around small intestine 11 that clearly shrinks and or softens the tissue. When you find the right point, the patient reports that the cysts shrink very dramatically. Sometimes they can no longer feel them at all. Ocumoxa, direct moxa, is a must add-on for shrinking breast cysts. Small intestine 11, as well as the outer border of the scapula, can treat upper arm mobility issues. Except for breast cysts, the way I needle small intestine 11 is to find the puffy area and to surround it, needling at the edges of the puffy area inwards, and then I apply ocu, direct moxa, at the base of the needles. In the case of breast cyst, I have the patient sit up, palpate the breast, and I find the right point. I might needle it, or I might just do ocu. If I needle, I definitely do add ocu, direct moxa, to it. Small intestine 12, Bing Feng, is famously called grasping the wind. For me, as a non-TCM practitioner, it is not a point I use for, say, colds and flus. For me, the idea of grasping the wind makes little sense. The wind cannot be held. Its nature is not to be fixed. If the ancients wanted to suggest removing the wind as a therapeutic method, they would have named it something like, say, feng feng, release the wind, ban feng, shifting the wind, chi feng, removing the wind, or chu feng, to eliminate the wind. In other words, there were lots of options, lots of other ways to express this idea of removing wind. But they chose an expression to hold the wind, which is really not a therapeutic expression at all. And that does not suggest therapy. Rather, it suggests a description of a situation where there is no movement. It actually suggests a freezing response where we tighten our shoulders. It suggests the pathology. For me, the idea of the name holding the wind suggests this freezing kind of reaction of tightening the shoulders. There are many wind points at the occiput. We can see this area as related to invasion by wind, and we can also see this area as guarding the brain from too much stimulus, too much movement. Tightness at the occiput can result in the brain being unable to relax, unable to let go of thinking. At small intestine 12, the supraspinatus muscle tightens and creates a kind of freezing, a holding pattern in the upper body, often as a way to compensate for lack of core strength in the legs and lower abdomen. This can be seen as grasping the wind, a lack of flexibility, lack of movement, a tightening of the upper body. In terms of immunity, I do use the area under the scapular spine to affect the upper body lymph and for lung infections. This is below small intestine 12 and can go the length of the scapular spine, not just the center. These points are needle upwards towards the scapular spine, and as in any points used for lymph system, ocumoxa is a must addition. Small intestine 13, Jeffrey Yuen, the bending wall, basically describes the location of the point where the bone curves and hollows. Small intestine 13 reflects and treats the pituitary and is considered the posterior pituitary shoe. It shows pressure pain on women with hormonal imbalances and bears a relationship to bladder 32 in that the 2 points release each other. Yi Tian Ni referred to Sanja 15, Tian Liao, as the point that is related to hormonal issues. But we can see that we're basically talking about the same area, the top medial angle of the scapula, and whether we choose to look at it as small intestine with its connection to the brain and separating pure fluids, or hormones or sanjiao, is really a matter of taste and preference. Sanjiao 14 and 15, Jian Wai Shu and Jian Zhong Shu, suggest again the connection of the channel to the shoulder, mostly to the shoulder blade and its support of our gait. When the scapula rotates upwards, tension is created in the rhomboids and above, and the area of Du 13-14 becomes congested and puffy. Small intestine 16, Tian Chuang, the heavenly window, is on the back of the SCM. So it is part of the points that affect the SCM, the thyroid and the vagus nerve, and by extension, the autonomic nervous system as a whole, and the communication between the brain and the body. This is probably why it is named heavenly window. Chuang, window, connotes the space inside the frame of the window, because it has the character for window and then a cave or a hollow space above it. The other 2 points with a character Chuang, window, are gallbladder 16, Mu Chuang, the window of the eye, which suggests the space of the auricular orbit, and stomach 16, Yin Chuang, the window of the breast, again likely referring to the space of the breast tissue as formed by its borders. Sanjiao 16, Tianyou, is also translated as heavenly window, and it is just above small intestine 16. But the connotation of yo is to lead someone through an opening, to take them through, to teach them, to enlighten them. So even though they are both considered to be heaven windows, they're actually different points, even though they're also very close to each other. The actual connotation of the character used is different. Small intestine 17, Tianrong, heavenly appearance, might be referring to the face, which is at the base, which small intestine 17 is at the base of the face. Whether this is a Taiyang or a Shaoyang point seems to depend on which century you happen to be in. That suggests that the channels are flexible. Small intestine 17 can reflect the parotid glands, in which case we use kidney 3 to release that, as well as tension under the gums, which can be seen when the perineal floor is not being engaged, and the body is making an effort to lift itself up from the top rather than to support itself from the bottom. Releasing the area under the teeth can re-educate the patient to find the perineal floor and their core. Small intestine 18, Chuan Liao, the cheekbone Liao, is named after its location. But we still want to recall that Liao is not simply a bone hole, but connotes the sound of wings searing through an opening, like a conch. So Liao connotes an ability to amplify. The zygomatic arch, with its nerves, and the sphenoid cavity represent such an area. And we have a number of Liao points here. Stomach 3, Jiu Liao, the great Liao, as well as large intestine 19, He Liao, the grain Liao, and further out and up we have Sanjiao 22, He Liao, the harmony Liao. Of these, small intestine 18 might be considered the most significant. It is considered to be the meeting point of the 3 leg-yang sinews, and Chuan, cheekbone, connotes strong, strength, as in one having strong character, indicated by strong cheekbones. The character Chuan is made of guan, a stork, on the left and head on the right. If we replace the right side with jian, to see, a big eye, we get guan, to observe, to look deeply, to understand, to absorb. When we have the head on the right side, as we do here, it might suggest the same thing for all sense organs, not just the eyes, to absorb all the senses. And small intestine 18 is indeed midway between the eyes, the nose, the mouth, and the ears. It has the ability to take in all the senses. Small intestine 19, Tinggong, is the listening palace. I use this point as a diagnostic point to assess treatment points that affect hearing. Small intestine 19 and gallbladder 2 are used with a point behind the ear under the fold, which is named ear yang wei in the Kauai protocol for treating deafness. This treatment involves 3 bypass cord and a pachi pachi.